justice for all.
I'd like to request the clerk call the roll.
Madison. Here. Whitego. Coombs.
Here.
Simmons.
Here.
Stats.
Here.
Adams.
Here.
Mettler.
Here.
Collins.
Here.
Riley.
Happy to be here.
Eldridge. Helsley.
Here.
Kirsten.
Here.
Agonia.
Here.
Cousin. Here. Mia.
Yeah.
Schmiedis.
Here.
Hussman.
Here.
Scalera.
Here.
Jesse.
Here.
Holding. Here. Morel.
Here.
Not.
Here.
Skoda.
2893 present, 642 absent.
We have quorum.
Thank you. Next, I'd like to open the public hearing. It's local law 1 of 2022, authorizing the county to continue holding virtual public meetings. And I'd like to ask the clerk to read the notice.
Notice is hereby given that on the 11th day of May, 2022 at 7 p.m. in the Board of Supervisors Chambers at Columbia County Office Building 12 State Street, Hudson, New York, the Columbia County Board of Supervisors shall hold a public hearing on the enactment of local law 1 of 2022, authorizing county to continue holding virtual public meetings in accordance with the WW of the laws of 2022. This notice is given pursuant to the directive of the Columbia County Board of Supervisors dated April 29, 2022, Hudson, New York, Kelly S. Picaro, clerk of the Board of Supervisors.
Thank you. Do any supervisors have any comments? Rob told me I need to do this one, so. Does anyone from the public have any comments? With that, we'll close the public hearing.
I always have something to say. I like that.
All right, we're gonna do a roll call vote.
Hold on, just one moment, we'll just have to clear the screen. So this is gonna be for local law 1 of 2022, authorizing the county to continue holding the virtual public meetings according to Part WW of the laws of 2022. Madison.
Yes.
Weigelt. Coombs.
Yes.
Simmons.
Yes.
Stats.
Mr. Chairman, I'd just like to say, I was gonna hold my tongue, but I just can't hold my tongue. I really hope, I see the necessity for this in emergencies, but I really hope you'll use your discretion and not to continue this for our regular meetings, no need for emergency purposes. But I do see the necessity for this, while we look at this.
Adams.
Yes.
Mettler.
Yes.
Collins.
Yes.
Riley.
Yes.
Eldridge. Helsley.
Yes.
Kirsten.
Yes.
Agonia.
Yes.
Cousin.
Yes.
Mia.
Yes.
Schmiedis.
Yes.
Hussman.
Yes.
Scalera.
Yes.
Desi.
Yes.
Hotley.
Yes.
Morel.
Yes.
Not.
Yes.
Skoda.
2893 ayes, 642 nays.
So the law passes.
Thank you. Okay, we need a motion to pay the bills, accept the treasurer's report, and file the minutes within the clerk's office.
I'll do that.
Okay, we have a motion, second? Second. All in favor?
Aye.
Message from Denise, which if your brother is lost and wait until Saturday for
Something that links into them.
Okay, next we have Christy Frederick from the health department, who's going to do a training. Who's with you, Christy?
Victoria McGann.
There.
Good evening. Our names are Victoria McGann and Christy Frederick, and we work in the Opioid Overdose Prevention Program. Oh, I forgot to turn it on. It will be, sorry. So we're Victoria McGann and Christy Frederick, work in the Opioid Overdose Prevention Program for the Columbia County Department of Health. So we're here tonight to train you in the administration of Narcan, a life-saving opioid overdose reversing drug. We also want to take just a few minutes to give you some background information by way of sharing local overdose data from 2020, 2021, and 2022 as of May 2nd. That comes to us through the OD MAP program. We'll explain how that program operates, and we'll also identify some of the assets and obstacles to opioid overdose prevention we see in Columbia County. Obstacles we see include stigma and shame felt by those who use substances, often also felt by their families. This is a long-standing issue that unfortunately persists. Lack of local harm reduction services exacerbates the stigma and shame felt by individuals who use drugs. We'll also talk about what harm reduction is and the role it plays in preventing opioid overdoses. The COVID-19 pandemic, of course, has emphasized the vulnerabilities of our most vulnerable. We'll briefly discuss the implications of the pandemic on people who use drugs. We'll start by discussing our assets by describing the OD MAP program.
Hello. ODMAP is a software sponsored by HIDA, which stands for the High Intensity Drug Trafficking Areas Program. And this software allows first responders to report certain information about overdoses from substances in real time. ODMAP allows for an element of speed in acquiring and disseminating potentially life-saving information, something we didn't have before. This is separate from coroner data, as that information includes results of toxicology screens and everything that could take days and weeks and months. So first and foremost, I would like to make a brief highlight of Columbia County 911 Center, because they are the headquarters for the ODMAP software, and they are the ones that keep it going. Columbia County Department of Health partners with the listed agencies on the screen, just a few, to get a clear picture of the real-time situation as possible. When emergency services are on scene, they report certain data points to be uploaded into the software. It includes location, age, gender, substances used, etc. A key feature of this program is to allow for notification of spikes in overdoses. Columbia, as well as surrounding counties, are able to put out alerts when we or surrounding counties are in a spike, so that the first responders and people who use drugs can be prepared with additional resources. Columbia County Department of Health and other partner agencies also prepare in our own way by monitoring the situation and deploying Narcan trainings, additional mental health supports, safe use supplies when we are in a spike.
This slide illustrates the number of reported overdoses shown on the screen in the blue bars through the ODMAP program. In 2020, we had 75 overdoses, 91 overdoses in 2021, and as of May 2nd, 31 in 2022. The orange bars represent fatalities due to substance overdose. So far in 2022, we've had 6 overdose deaths. We are outpacing the last 2 years on both counts, that is fatalities and overdoses. The yellow bars indicate cases in which Narcan was administered. There were 5 fatal overdose deaths in Columbia County during the first quarter of 2022. This matches the greatest number ever recorded in a single quarter. There were also 5 deaths in the third quarter of 2020. Noted on the left side of the slide repeats the 2020 overdose statistics. That is 75 reported overdoses, 8 fatalities, and 50 cases of Narcan given. A significant benefit of the ODMAP software is the ability to report the location of the overdose. The key on the right side of the slide shows the color coding of the zip codes. Darker colors indicate higher numbers of overdoses, lighter colors indicate lower numbers of overdoses.
What is the number on the darkest one? I can't see it.
13, greater than 13.
But what is it called? I'm sorry.
12534,
Okay.
12534.
which encompasses a very large area.
Everyone.
In 2022, here again, you can see the changes by zip code from 2020 to 2021. 91 reported overdoses, 12 fatalities, and 57 cases of Narcan given according to the OD MAP program. Again, this is by location of overdose, not by residence. It's important to note that many other data sets, particularly from New York State, report this kind of information based on residence, not based on location of the actual event, which can explain some differences. And here we have information for 2022 as of May 2nd. 31 reported overdoses, 6 fatalities, and 21 cases of Narcan given. The following few slides represent overdoses per month. Here in 2020, note initial increases in March and April that stay pretty steady until the summer months. There's a slight dip in June, an increase in July, and a large spike in August. Low again in October, and then a bit higher around the end of the year. Here we have 2021. Note double-digit months for January, March again, and another annual high in the summer, this time in July. September also saw a double-digit month and stays steady in October, November, and December. And finally, so far in 2022, another high month in March, and we have one reported in the first 2 days of May, with new overdoses reported since then. We have a lot of year left, especially if we follow the pattern of a high month in summer, and then steady and high fall to winter. This is a visualization of 2020, 2021, and 2022 thus far, grouped by month. Our highest months tend to be March, July, or August. Here we can see, Here we can see overdoses by gender. They tend not to be too dramatically different, with a slight towards males suffering overdoses. It's important to list the not listed refers to an issue that we're working on with New York State Police. Again, we're trying to fix that so that we can get those numbers as well. Now we move on to overdose by age. Here they're grouped into less than 19, in their 20s, 30s, 40s, 50s, 60s, and over 70. In 2020, the highest age groups were people in their 20s and 30s. And again, the not listed refers to the issue with the New York State Police that we're working on. In 2021, the highest age groups were people in their 30s and 40s. And then in 2022, again, the highest age group so far has been people in their 30s and 40s. Finally, we have the substance reported on the scene of an overdose. This represents information provided by first responders using their best educated guess as to what substance was used. When it comes to the substance, coroner data, of course, would be more accurate. But again, time is a luxury we don't have when we are in an overdose spike, which often means there is an excess of fentanyl in the drug supply. According to coroner data, since 2020, at least 50% of all deaths involve stimulants in combination with fentanyl. An obstacle we face when working in overdose prevention is stigma. Stigma is a set of negative beliefs a group or society holds about a topic. Some factors that influence stigma include blame, stereotypes, lack of knowledge about substance use disorder, firsthand contact and experiences, media portrayals, race, ethnicity, and culture. Some consequences of stigma include secrecy of the person using drugs, isolation, delay in seeking help, refusal of services, increase of mental health issues, preventable overdoses, and preventable deaths.
It is important to understand that becoming dependent on substances can happen to anyone. Lack of knowledge and understanding about what causes people to start using drugs makes it easy to blame individuals for their substance use, when in reality, it is most often adverse childhood experiences caused by their environment that lead people to start using drugs. These experiences continue to happen each and every day and continue to afflict the next generation. We can tell what our future will look like by taking a look in our classrooms. Schools need our support now more than ever to prevent early onset of substance use.
So one other obstacle that we're faced here in Columbia County is a lack of harm reduction. And the definition of harm reduction is an evidence-based public health approach intended to reduce the harmful impacts of behaviors associated with substance use disorder. That sounds so smart. Some examples of harm reduction outside of the world of substance use disorder would be sunscreen, seatbelts, helmets, and speed limits. And they're all adapted in our society. A lot of people think that harm reduction is kind of a legalization, but in fact, its primary goal is not necessarily to stop all drug use, but to reduce the harms such as infectious disease spread through the sharing of needles and probability of death from overdose. Harm reduction focuses on reducing risky behaviors and death associated with drug use, not necessarily complete abstinence. Not going to read everything. But current harm reduction practices that we're doing in Columbia County are Narcan trainings, peer support services, and fentanyl test strips. Some things that we want to work on would be MAT, which is the Medication Assisted Treatment Provider numbers, housing a detox rehab facility, and syringe exchange programs.
It is unreasonable to consider our current and future status when it comes to substance use disorder without considering the impact of the pandemic. The pressure and instability that resulted from COVID-19 exacerbated every vulnerability of our community, including and especially people who use drugs. Every one of us became more isolated and more disconnected, especially those engaged in services and actively working on their recovery. That all is to say that we'll feel the repercussions of the pandemic for a long time, especially when it comes to mental health, impacting all ages differently, and will continue to influence the lives of children, especially with those with already complicated lives.
All right, so the last thing before we do Narcan trading is just a community partnership, another asset for our county. I'm sure you guys are all familiar with a program called Greener Pathways, which is under Twin County Recovery Services, and I would just like to highlight that group tonight. They are what we call our county CODI, which is the Center of Treatment Innovation, and that group, Carl Quinn, does amazing things with us at the health department, and without them, we probably wouldn't be able to accomplish a lot. Some of the things we accomplish are the peer services, Narcan trainings, fentanyl test strip distribution. We're going to be coming out with a nice media campaign soon, and you're probably going to be seeing these placed in different areas of the county in high-incident overdose areas, because what it is it's an opioid emergency kit, and inside will be a Narcan kit that will be readily available for someone to use in case of an overdose. We've gone to locations where overdoses are high in incidence, and places have agreed. We're kind of doing all the logistical work, but we will probably be rolling this program out very soon. So now the reason why we're here tonight is for Narcan Train. So PJ could probably come up and help me with this. No?
Good.
Okay, all right. So we're in the home stretch, guys. We're in the home stretch. Classes of opioids to talk about before an overdose. When we talk about an overdose, we don't just mean heroin and street drugs. We also mean prescription medications that are in everybody's cabinets. We also mean the medications that are made from pill presses where people get off the black market. We mean fentanyl, which is fentanyl that could be given from a hospital procedure, or fentanyl that is created in Mexico and shipped to the United States. There's more and more synthetic opioids coming into this country. There's a new one that's coming out that I just read about today. We have xylazine, which is a horse tranquilizer. We have carfentanil, which is an elephant tranquilizer. So it's unsafe to use any kind of opioid out on the street. So we just want to make sure everybody's aware of that. So what happens when someone overdoses is an opioid, actually there's receptors on your brain and the opioid attaches to that receptor. And when the opioid, too many opioids or too much of an opioid attaches to those receptors, what happens is the opioid represses your urge to breathe. And that oxygen carbon dioxide exchange doesn't happen and people stop breathing. Because what the opioid's purpose is to relax you and take pain away. If the opioid stays on that receptor too long or too much of an opioid is on that receptor, it can lead to a fatal overdose. Risk factors for the opioid overdose, I'm just going to touch on the two big ones, a loss of tolerance and mixing of drugs. Someone's loss of tolerance can happen within 72 hours. So we have a resident that gets admitted to the jail over the weekend, gets admitted to rehab, or even just says, you know what, I'm going to stop using this substance for a few days. They stop using the substance, start back up again, and they said, I'm going to use the same amount that I used last time. They put themselves at a very high fold of having a fatal overdose because of that loss of tolerance. Mixing drugs. A lot of people think, okay, I'm going to use my substance, have a drink, maybe take a Xanax or a Valium to calm me down. That mixing of that medication can potentially cause a fatal overdose. Progression of an overdose. Very rarely do we find somebody lying on the floor with a needle coming out of their arm. Yes, it can happen. I'm sure there's stories of it. But what happens is an overdose is something that usually happens over time. So, just use as an example. You have a coworker who reports for work, seems fine when they report for work. 3 hours later, they start acting a little squirrely, they start to act a little bit sleepy, they just aren't acting like themselves. It can be up to 3 to 4 hours later that they can overdose from a substance they used hours before, okay? Progression of the overdose. Most times when someone's overdosing, the top symptoms is a head nod. The head starts to go like this. Now, I'm watching the room now, and nobody's doing it, so I must be doing a pretty decent job of my presentation, because, it could be a boring presentation, it could be a different kind of medical condition, it's not even an overdose, or it could be an overdose. If someone's falling asleep, usually when they hit that, their head picks up. When someone's overdosing and it's progressing, their head is just going to slowly go down, and what they're going to do is they're going to start to make some gurgling, snoring sounds, their respirations are going to slow down, and they may even start to have skin color changes. Bluish color on the lips, blue fingertips, toes, because the oxygen carbon dioxide exchange isn't happening because everything's slowing down. All right, so how are we going to fix them? We're going to get our medication out called Narcan, which is also called naloxone, which is the generic name for it. And Narcan is a perfectly safe medication. If there is no opioids in your system, nothing will happen if Narcan is given. A lot of people say, I don't know if I should give Narcan, I don't know if they're overdosing. Who cares? EMS will roll up on scene, and if someone is unconscious and they do not know what's happening to this person, they give Narcan. So it's perfectly safe. It is a very short-acting medication. We'll talk about that in a few slides. Don't worry, there's not a lot more. And it usually can wake the person in roughly, anywhere from 2 to 5 minutes. It is a medication that's temperature controlled, so we ask you not to leave it in your car, leave it, anywhere where it can get too cold or too hot, and Narcan does expire. All right, so what we're going to do is we're going to check to see if someone is actually overdosing. So I'm going to use Mr. Knott here because he's closest to me. So Mr. Knott is not responding to me. He's completely unresponsive. I say to him, Mr. Knott, can you hear me? Hello, Mr. Knott. I shake him a little bit. Nothing. So what I'm going to do is I'm going to perform a very painful stimuli to Mr. Knott. I'm going to take my hands, my knuckles, and I'm going to rub it up and down his sternum very hard for 5 to 10 seconds. And if Mr. Knott does not respond, He's overdosing, he's having a medical emergency, something's going on. So I need to act. If he's not just taking a nap, he's gonna be one ticked off person because that will hurt. So that's kind of how we see if someone's actually having a medical emergency. All right, so Mr. Knott is not responding. So what we're gonna do is we're going to either activate 911 or go grab our Narcan. In CPR, you gotta do it in a certain order. Here, what we do is we tell people you have cell phones, put it on speaker, get your Narcan, and you're gonna give it to the patient, all right? Giving naloxone is a very easy thing. I have some. No, it's in this kit right here. This is what it looks like, and all you do is you peel it, take it out of the, whoops, the little plunger just fell. Take it out of the container, put it in the nose, tilt the head back a little bit, and push the medication into the nose, okay? And then you sit and wait. And you sit and wait for 2 minutes to see if someone responds to the medication before you can either A, give them their next dose, or B, hope to God the ambulance arrives. Because we call 911 because each kit contains 2 doses of Narcan. If a person overdoses, with all of these drugs in this world today, a lot of times, these overdoses are taking in excess of 5, 6, 7 doses of Narcan. We have 2. So you know what? Let's give them off to Greenport Rescue, Chatham Rescue. Let's get the ambulance on scene because they need that higher level of care. During those 2 minutes, if the person is not breathing, if the person does not, have a heartbeat, you can administer CPR and rescue breathing if you're certified. If you're not certified, you can actually, the 911 dispatcher will walk you through it, and there will be a face shield in the kit. So don't be afraid. That's why we encourage the use of 911. All right, the rescue position. If you have to leave someone for any reason to go get your Narcan, call 911, to do anything, we want you to turn that patient on their side. And the reason we want you to turn that patient on their side, turn their head to the side, is sometimes when people come out of an overdose, they vomit. And we've actually lost an individual in this county to aspiration because he aspirated his own vomit. So we want you to turn their head in case they are to get sick. There's a ghost turning them in this picture. So a high note on this is the New York State's Good Samaritan Law. And the reason they had enacted this back in 2011 is because so many people were dying from overdoses. They were just leaving Mr. Knott to die because no one wanted to deal with the drugs that were on Mr. Knott. No one wanted to, to get into trouble because of helping him. So what they did was they enacted the Good Samaritan Law, and what it protects is the person overdosing and the person calling for help, and that miraculously started to save lives. And this is what it protects you from. 8 ounces of a controlled substance. That is a lot of a controlled substance. Alcohol, paraphernalia offenses, sharing of drugs. Some things that it doesn't protect you against is if you are on parole, if you have a child on scene, it doesn't protect you from Child Protective Service issues. All right, so you use your Narcan kit. What are you going to do afterwards? Because you do want to be well equipped. You can call me at the health department. You can call Victoria. You can call Carl at Greener Pathways, or you can text Narcan kit to 21,000. That's a texting program that Carl started during the epidemic of the pandemic to get Narcan into the hands of people. I have to say this word. This is NCAP, which is also, you can walk into any pharmacy and get a Narcan kit. You walk up to the pharmacist, say you want a Narcan kit. They provide you with a kit, they bill your insurance, and the copay is picked up by the New York State Office for Drug User Health. Not a very successful program, but I have to tell you. All right, so that is it for the program. Thank you very much. Hope we didn't put anybody to sleep. We look good. Can I just steal your sheet?
Sure.
All right. So what we have is this sheet right here with our wonderful emblem on it. If you guys are interested in walking out with the Narcan kit, because what we would love for you to do is take this kit back to your town halls, talk to your staff, talk to your community, have Narcan training scheduled. We'll come out and do it, We have shorter versions, longer versions, it depends how much you want to listen that night. But anyways, if you guys fill this out, we'll come around with Narcan kits to hand out. We just ask you to fill this out and give it back. And we also just have a sign-in sheet, because what we have to do is we just have to prove that we talked to all of you if you took a kit or not. Don't feel pressured to take the kit. Thank you very much. Yes, this is January of 2025, your kit expires, so you've got it for a long time.
We've got one at the town hall now, but I think it probably is expired.
Yes,
So we have a bunch at the town hall. Greener Pathways came and did the Narcan training with the van.
Yep.
So I heard you say it can take up to 5 doses and there's 2 in each kit.
Mhm.
So we often have a half-hour response time because we're in Lebanon. So can I give more than the 2 doses? Can I go
Absolutely.
grab another
Yep.
kit and give a
Yep.
3rd dose or a 4th
Absolutely,
dose? Okay.
yep.
And people will just take that. If you see people outside and you ask them.
Oh,
they
I'm sorry.
want Narcan, I pass out 5 to the homeless folks in the park and they're just willing to have them, so you don't have to hold on to them either and wait for
Yeah, no,
somebody to ask for them.
we're gonna be, launching the Narcan emergency kits in the homeless motels as well. Yorkshire didn't have a single Narcan kit available, and people were saying that they were overdosing, so we're working on it, it's a work in progress.
Can I ask you a question?
Yeah,
In 2021, my number may be wrong, but I think you said you had 12 deaths.
yes.
Were any of those individuals given Narcan?
Yes, that is information that we could give you, on like an email request. We do have that, what we do is in ODMAP, there's like 4 big questions. And one of them, and if Narcan was given, was multiple doses of Narcan given. So what shoots out to us would be a fatal, no naloxone given, or fatal, multiple doses given. I could provide that with you. Rob, okay, yes.
And are you gonna make the slideshow available to us?
We could if you'd like.
Send it to Kelly, send it to us.
Wow, so you go, okay, sure.
We've already-
We had 1, 2, 5, 6, 7 zip code, because you're missing my entire town on the chart, for the West.
Because you, okay, 1, 2. Oh, all right, you know why? Northern Dutchess, NDP. You know what, I can look into that, most definitely.
You're missing parts town road.
Absolutely, because it's serviced by Northern Dutchess Paramedics.
Okay, Germantown's probably
Yes.
maybe low.
Yeah, maybe lower than should be, absolutely, yes.
I hope not.
You're good.
That'd be the school kids, because there's 3 districts that overlap. Sure.
You're very welcome.
Absolutely.
Thank you.
Nice job, very nice.
Yes.
But,
Yeah, I sent the back row.
yeah, because it's all ages, all socioeconomic, all education, all that kind of stuff.
Yeah.
And it's not all driven by having a hip replacement or a knee injury.
Oh, yes, yes.
Absolutely, can you put 2 down, bring them
Dedicated people, and government, when things happen. That's it. That's it.
Only care.
Number of person numbers.
Absolutely, you can also.
I'll call myself and write them checks again, so.
Absolutely, absolutely.
This is more often where people are involved in their children's 30-year-old and below issues from others. Or it was, I suddenly.
You can actually, yeah, just reach out to me at the health department, Christy.Frederick@ColumbiaCountyNY.com if you're interested in the boxes. What we're doing is we're just kind of starting out Bliss Towers, Greenport Garden Apartments, DSS. We're gonna do the city park down in Hudson. and we're gonna try and work our ways to outskirts as well. So if you have a place that's known higher in incidents, reach out to me and.
But there's a pretty box. I put it in the town hall, you know where it is.
Come with a hammer to break the glass.
Yeah.
Thank you.
With the emergency box, this stuff is temperature sensitive, you said, so.
Yes,
best
it's
to have
gotta be inside.
inside and
I
temperature
know.
controlled. That's fine, I
Yes,
just wanted to confirm
yes,
that.
yes.
Chris, did you get your signage?
Yeah, you can't put it like in a pavilion that's outside or
Well, we
something.
were like, this could be perfect, we can put it so many places. No, we can't.
Yeah, no, that's,
We gotta keep them happy.
that's understood.
I think it's gotta go up to this row here.
Did you sign?
Good job.
Thank you.
Rob, did you sign?
Thank you very much for giving me.
Thank you.
Thank you.
Thank you.
Do you guys want kids?
I hope you don't.
I'll take one.
You want one?
Okay, I'd like to request the first resolution.
Resolution 182 of 2022 to 192 of 2022 by Supervisor Mia.
Mr. Chairman, I authorize this resolution for the
A second. All in favor?
Aye.
Opposed?
Resolution 193 of 2022 to 202 of 2022 by Supervisor Sacks.
Mr. Chairman, offer these resolutions for adoption.
Second the motion.
All in favor?
Aye.
Opposed? Carried.
Resolution 203 of 2022 to 207 of 2022 by Supervisor Scalera.
Mr. Chairman, I offer these resolutions for adoption. Second the motion.
All in favor?
Aye.
Opposed? Carried.
Resolution 208 of 2022 to 209 of 2022 by Supervisor Basson.
Chairman, I offer these resolutions for adoption.
I'll second the motion.
All in favor?
Aye.
Opposed? Carried.
Resolution 210 of 2022 to 221 of 2022 by Supervisor Metler.
Mr. Chairman, I offer these resolutions for adoption.
Second. All in favor?
Aye.
Opposed? Carried. Okay, next, I wanted to ask, Ron to talk about the hazardous waste day and a request.
Yes, thank you, Mr. Chairman. I'd like to bring a resolution from the floor tonight, it's kind of at the last minute, but as many of you know, last Saturday we had Hazard Waste Day here in the county, which is an every year event, but this year we were able to also take latex paints for recycling for the first time. That event turned out to be hugely much more successful than we expected. Just to give you an idea, we took in 11,000 gallons of latex paint on Saturday. Paint care is paying for that part of the program. Some of the other products we end up paying 50% of through a contractor called MXI that we work with. So MXI is a contractor that actually runs the program for us. DEC is there to administer it. I do want to publicly thank Supervisor Collins, who spent the day there Saturday helping Jolene and Wendy and staff. It was quite a day. You can talk to him about that, I'm sure. But and I do commend our staff as well as our sheriff's office and Greenport PD and everybody who helped direct traffic. They had traffic backed up for miles both different ways. So it was quite an event. But when the phone's been ringing off the hook with residents saying I couldn't get there, I waited in line, I couldn't get there. We had to turn people away, and we felt bad about that. So Jolene has been scrambling real hard to try and set up a second date. We have a date now picked of June 5th, which is a Sunday, the first Sunday in June. We're going to do it at the Fire Training Center over at Commerce Park, where we've got some more off-road parking to bring people in and around. And both of those companies are going to operate under the contracts that we already have in place for them. But we had budgeted a total of $38,000 for Hazard Waste Day. And we spent $28,000 or so roughly last Saturday with the products that we did take in. So what I'm asking the board for is to approve another $20,000 of total spending that we can pick from our ARPA fund or wherever we want to take it from. I'm open to suggestions, but I guess the suggestion has been made to take it from ARPA. funds so that we can fund that. And that is a 50% reimbursable thing from DEC, so if we spend the money, we'll get 50% of it back from DEC someday in time. Although PJ is always talking to us about keeping cash around, we're still waiting on the DEC reimbursement from 2019, I think, too. So, it's out there, but yeah, I think it's a very important program for the county. Our residents were very pleased to take part in this, and we've had a lot of house sales in the county here. And that seemed to stir up a lot of hazard collection. So I'm glad that people are participating and doing that, but anyway, I'm making a motion. Oh, you have a question?
I do. I fully support this, and thank you to Jolene and her team and Denal and everyone for being involved. I did just have one question. If we use ARPA funds.
Yep.
And it's a DEC 50% reimbursement.
Yep.
Have we checked with the ARPA or the attorney, because my understanding with ARPA funds is that it would be seen kind of as double dipping, because ARPA isn't a grant, but it's funding coming in, and I'm just concerned that we would then go to get the reimbursement and we end up spending 20, and if we don't have an answer to that question, I'd feel more comfortable pulling it out of a budget amendment, using the ARPA funds somewhere else to ensure that we get that 50% back. Maybe we know an answer to that question, but I do have a bit of a concern about using ARPA funds for something that we're then gonna get.
So we did that, what we budgeted some ARPA funds for the new tipping station at the solid waste station, which was a DEC 50% reimbursement thing.
Okay.
Originally, we put some money in there for it, but once we got bids onto it, and we realized that we're gonna get 50% reimbursement for that, what the controller did is just budget for what our actual cost is. So at the end of the day,
So
if we
our
spend
50% is
right.
ARPA funds.
So our
$100,000
50% would be
budget.
$10,000 of it, and we could
Okay.
put that in the budget, but we do have cash flow issues, and we may not spend all of that. Like I said, we've got $10,000 left in the budget right now to do this, but if we collect a lot more stuff again, we're gonna be short of money. We didn't wanna turn people away because of lack of funding, so.
I'm comfortable with that if the 10,000 is ARPA and the other 10,000 is a budget amendment that then can get reimbursed back. I just would hate to.
We can work with the controller on that. I know PJ brought that up earlier too, that, however we do it, but I think if the board just approves the additional $20,000, we'll make the controller find it. Yes, Art?
I support this 100%. I've just got a question about next year. Are we thinking about doing multiple
Yes.
sessions next
So
year?
yeah, actually, I met with Jolene today, and she's filling out applications for next year's program now, because you have to schedule these things that far ahead. And I told her, let's count on 2. We haven't even got to the budget part of it yet, but we, in the application to DEC, so we are asking for a spring and a fall one next year.
Okay, good, thank you.
Yes, Brenda?
The other thing I want to say is I do think that paint was a major factor in the volume that we
Yeah.
experienced. But I also think that the fact that we have all these active climate smart committees, that we have a very different level of promotion in the
Promoted.
community. And many people that had never been aware of this event at all, were calling about it. So I think the consideration to do multiple events next year is a wise one. And I think
So anyway, I bring a motion from the floor, just asking to approve the funding and the operation of it. So, a question, I'm sorry, Don.
It's not a question, I'm just repeating what I said, that Jolene and Wendy and her staff were working their heads off to try to get people in and out of there so they could accommodate, the traffic was going all the way into Hudson, I believe 7th Street.
By 9 o'clock in the morning, she was calling me going, what do I do with all this?
And Greenport Fire showed up and helped flag, and the sheriff's helped flag, I believe, so there was a lot of people came out to help, and they worked their heads off.
They did.
I fully support it.
I will second the motion.
Thank you, Art.
All right, so this is gonna, because it requires a 2/3 vote, this will be a roll call vote.
Right, just to bring it to the floor.
The motion right now is to consider it because it didn't go through the committee process. If this motion carries, then the next motion will be to actually pass the authorization.
Does this motion have to be a roll call as well?
Roll call.
So, Mr. Chairman, I'm still a little confused about where the money, is this just money comes from somewhere at some point?
Part of the money's gonna come from the stimulus money, the ARPA. And if need be, the other part of it can be a budget amendment, and coming out of our, fund balance.
That just looks very confusing. So is it 10,000 or 20 or just, there's an unknown
Ron is
number?
requesting 20, we may not spend all of that, but just to be safe. At this point.
And so I think the motion, if it was a written resolution, is to bring $20,000 forward with up to 50% of it. The ARPA funds up to 50% to be found in the budget somewhere.
Okay, so we have a motion and a second. We need to do a roll call.
Bassett,
Yes.
Weigelt, Moons,
Yes.
Simmons,
Yes.
Stacks,
Yes.
Adams.
I'm so grateful that we're offering this service to our residents, I happily vote yes.
Mettler,
Yes.
Collins,
Yes.
Riley,
Yes.
Eldridge. Helsley,
Yes.
Kirsten,
Yes.
Ligonia,
Yes.
Cousin. Mia,
Yes.
Venus,
Yes.
Mussman,
Yes.
Scalera,
Yes.
Bezzy,
Yes.
Holdway,
Yes.
Morel,
Yes.
Not,
Yes.
Skoda,
3186 ayes, 699 nays.
the motion passes to bring it.
Increases our odds of
So now we have to vote on the actual.
Now you have to
Mr.
vote on
Chairman, I would
it.
like to make a motion to send up to $20,000 for the second as of this release date, up to, with 50% coming out of our funds.
We have a second.
Second.
Motion and a second. I need a roll call. No? No?
Oh, we don't?
All in favor?
Aye.
Opposed? Carried.
I said sure.
Well done.
Thank you,
Until someone told me sure.
No, thank Jolene and staff, they really worked hard.
Okay, do any supervisors have any business to bring to the board? Supervisor Hope.
Mr. Chairman, I would love to turn the floor if possible to Mr. Tucker. I know some supervisors wanted a little more information on the CED, the resolution we passed number 208 tonight, and would appreciate if Mike could do a quick summary for supervisors and answer any questions.
Thank you very much, and thank you very much for approving the resolution. With me tonight is Bill Gurlick, the president of the Columbia County Chamber. Those of you who are familiar with the program, Columbia Forward, it will build on the successful Columbia Comeback program that Chairman Morell and all of you approved back in 2019 to help businesses go through the pandemic. We have had the opportunity to work with many businesses over the past 2 years. And what we're finding is that we feel it's necessary to get out further into the towns and the city itself with services. Also assist towns that have economic development committees with some structure and templates to put plans together. We have been doing that as requested, but you may recall we had applied for a USDA grant with Patterns of Progress 2 years ago, and we're using some of the template and some of the concepts from that plan to promote Columbia Forward. Just as part of this effort, we have included a loan program, and the loan program will be using up to $500,000 of CEDC loan funds. We currently have a $3.2 million portfolio. We have about $1.8 million already out, so we have these funds. You included in the program $50,000 for us to use to incentivize borrowers to come forward. And they can use those funds either to prepay their interest and principal, or they can use those funds to advance their business. This is part of a program and an expansion of a program that CEDC has run for many years. In 2021, we secured a $180,000 grant from the USDA to provide technical assistance to small businesses. We secured $400,000 in funds that allowed us to increase the portfolio of funding available for loans. We conducted an 8-week micro business seminar, and we closed 24 loans last year, totaling $535,000. Half of those loans were from the SBA funding, and the other was from the county funding. In the past 10 years, CEDC has borrowed over $1.5 million from the SBA. and we have received over $800,000 in technical assistance. This year, we applied for and have been tentatively approved for $232,000. So the money that you're making available to us over the 3 years in partnership with the Chamber will allow us to strengthen those programs and actually have staff that will be able to respond to people and provide the linkages and services. We're waiting on federal legislation that may reopen the Restaurant Recovery Fund. We had worked very hard with individual businesses on PPP 1 and 2, as well as with the EIDL program, which, as you know, just all of the funding was absorbed. We have benefited in making grants of up to $250,000 during COVID with small businesses where the funding came from the Berkshire Taconic Community Foundation. We provided administrative support to the City of Hudson's Tourism Board with $180,000 of grants. And I know some of the concern is, are we getting more money to do what you're already paying us to do? But the answer is we're flat out and we need to have additional staff. We have one position open, the project management position. It's very interesting because we have had this position open for 8 weeks and we've only had 2 inquiries. And we had it on Indeed, Monster.com, the Gannon list, which is a website-based regional website. And I actually spent about $250 putting it in the Columbia paper and 3 times in the Register Star.
This project manager position you're speaking of is the position,
Yeah.
2 positions that are going to be funded through the resolution we just passed.
What the CDC, well, the way the budget will work, the $50,000 for the loan fund incentive will go to CDC. The $150 over 3 years totaling. CDC is going to take $10,000 as the administrator of the program, and then we will use another 10 to be sure the website and the marketing and coordinating that with the Chamber. And then we're going to split $130,000 50-50 with the Chamber. And what we see the role for the Chamber is, we have the list of the 75% of the 2,000 businesses in the county who receive PPP 1 and 2. We've sorted that by town. It's available if any of you are interested in that. And we finally have really good data. Normally you have to buy a list for $600 and half the people are already out of business or no longer doing what they were doing. But this data is less than a year and a half old, and it lists the name of the business, the principal. Unfortunately, they didn't add email addresses, but it does give us a chance to see the size of businesses. And the reason for partnering with the Chamber is so that they can focus on the businesses that are more geared towards Chamber membership, and CDC can work with the startups and businesses that are growing and expanding.
So these 2 positions, $65,000 each, can you email the supervisors how someone would apply to either or?
Sure.
In case we might have.
I know
applicants that might be
I can let Bill Gurlick speak about the position at the, and think about this, you know what the benefit costs are for people, so it's more like a $50,000 position when you take out the health insurance and the taxes and the other benefits that are required. But certainly, and I would think that we'd be making, we have had 2 interviews, and we'd be happy to over the next 10 days to 2 weeks consider anyone else who applied.
Mike, are these individuals going to be actually making loans, or are they going to be facilitating?
They're going to be facilitating because we do have Martha Lane and Lauren Krana are running our loan program. And again, people who are accessing the loan part of the program, not the technical assistance, are going to have to meet some underwriting credit criteria. Generally, we did $300,000 of loans during COVID in a special program where if you had been in business for 2 years, if you had a credit score of 600, you could get $15,000 in 48 hours. And many small businesses took advantage of that to reopen their restaurant and stock the kitchen, or do other types of, instant need recovery efforts. And the best part of that was it was a 6-month deferral, so it was really a 5.5-year loan. And at 3.75%, the payment was $275 a month. So you could give someone a real surge of a small business, not, bigger business, that wouldn't mean anything.
So what will these two individuals actually be spending their time doing?
Well, on the CEDC side, we are looking to touch all of the people on the list, the 2,000 businesses, work with the town supervisor. If you have a economic development committee, attend their meetings, give them some guidance, help them develop a strategic plan, or give them the framework to work through a strategic plan and be available. I think part of this occurred when you had asked us to get involved in housing. And I went out to a meeting at the Rojan Housing Task Force. And we had 8 or 10 people, and they were community leaders and engaged business people. And I don't think 4 out of 8 knew what CEDC was or what we did. And that was embarrassing to me, number one. But number two, I think you all know the story I tell, that when I first took this job, my wife and I spent a Sunday afternoon and went to the parking lot of every town hall, and it took 7 hours and 240 miles. So we think that we need to work with the chamber, who goes out and does networking events, have our loan people go with them, have this person go, really raise the visibility of both organizations, and report back to you. And if we've said from the beginning, if it doesn't work the second year, either you have us do something else, or the program was a great experiment.
Yeah, good evening, everybody, and thank you for inviting me tonight. To build on what Michael just said, at the Chamber, we have a great value proposition that since I came on last May, we've been building upon. We have a great energy program that we are test marketing right now with a business on Allen Street over the Kate Arding's business. And we got to get the message out to people on something like an energy program like that. The first analysis is showing Kate that she can save up to $2,000 a year on energy by signing on with the Chamber Energy Program. That's the type of value add that we have at the Chamber. We have 570 members right now. We have over 2,000 businesses. So we still have to get our message across to what I think is the remote areas of the county. Just to let everybody know, 48% of our membership is in Hudson and Greenport. 52% of our membership is out in the county. Our densest part of membership is, believe it or not, in Getting Chatham area. So, but there's still a lot of people that don't know what we do and what we can do for them, because we're always offering education. We're constantly marketing our members on Facebook and Instagram 24 hours a day. And quite honestly, I can't do a chamber event without talking about Mike's micro business program and Martha Lane's loan program, and Mike's program. I think of Martha because she's the contact person. But quite honestly, it's a great partnership, I think, and I welcome the opportunity to go out and see these remainder businesses in the county. I think we have a great message to tell. And I do believe, as Mike said, a lot of people, despite our efforts, don't know what these organizations can do for them. And I gotta tell you, again, we've been out to New Lebanon, and that's a part of the county that we feel that we can help. We've been to other towns in the county, and the message is clear to us that we can help these people significantly. And
CEDC and the Chamber partnered very well in the Columbia comeback. Bill and I have worked very well together since he arrived. We also have the Regional Economic Development Council launch was last week. Applications are due at the end of July. We had over $18 million of awards in the county last year. Alana did get, I think $1.5 million of that, so it, there weren't a lot of small awards. But we'll be able to help businesses get those applications in. We'll be able to help them identify other state and federal loan programs. And, again, I had 3 calls in 3 days of someone who just bought a 40-acre lot in one of your towns and wants to get started with a new business. People want to relocate. We had someone come in today who wants to start a small business in Hudson. And you can't keep up with it. So it's really to build capacity, not to have you help pay for what you've already contracted for.
And just to let everybody know, on the employment side, I have 2 full-timers and 2 part-timers, and 1 part-timer wants extra hours. So I'm gonna have our membership director, Debbie Byram, head up this program working with myself and Mike's team. And what I'll do is I'll use those dollars to take that part-time person and make them either 4 days a week or 5 days a week to fill the gap in the office.
And from our perspective, it will help Martha have a pipeline, and it will free me up to continue to work on broadband, housing, and some of the other issues that you've all requested that CEDC assist you with.
Thank you.
Thank you.
Thank you. 1-800-CEDC.
Supervisor, can you just raise your hand up?
Thank you. Yeah, I just wanted to give the board an update on public transportation or just transportation in general. So we have a transportation planning committee. Supervisor Slater's on it, Supervisor Knott, and the chairman, and then Kelly and Chair are helping out with some of the administration. So I just wanted to give you an update and ask for your help as we work on it. So the county has to have a transportation plan that covers both public transit, but as well as things like the Office of the Aging and Healthcare Consortium and other sort of transportation services that we provide. Many of you have already sort of reached out to me and talked about some of the needs that we have. But so part of this plan is that we legally need to have this plan, but we also spend a fair amount of money on transportation. And so we want to look at, are we spending the money in the best way? So the first part of the planning process is to sort of establish what our needs are. What are the gaps in services? What are the barriers? So we're hoping that you all as supervisors can give us input on what you see as sort of the needs for some of your residents and some of your constituents. And we're sort of in a process of asking agency heads for input. We'll be doing some public outreach, but we know that all the supervisors have unique knowledge for what your residents need. So we'll be following up, and I just wanted to give you the heads up so you can start thinking about how to communicate what those needs are, what those barriers are.
Thank you. Any other supervisors? Supervisor Collins.
Yeah, I'd just like to express my gratitude and congratulations to PJ Keeler for that building named after him in tonight's resolutions. He's done nice to award it to someone instead of 50 years hence.
Only 50? Listen, I'd just like, you all know me, and again, this took a lot of convincing to be able to do this. And I don't do what I do for any kind of notoriety or publicity, okay? I'm a local guy, born and raised on a farm, okay? We always gave back to our community. My elders taught me that, and that's basically who I am. Although I appreciate the honor, it's very nice, but I'm gonna accept this on behalf of all emergency services, fire, police, EMS, 911. I think we are extremely lucky in this county to have what we have. I've been around the state several times in several localities, and they have nowhere near the emergency services systems that we have here in Columbia County. So we are very fortunate, and I'll accept that honor on behalf of all emergency services. And I thank the board for their support, because without your support over the years, this started way back with Jerry Simons and Donnie Klein, and we have moved forward since then. And without the board's support and you representing the people in your locales, this would not be what it is today. So you all deserve credit for that. Thank you.
Come on the 21st to celebrate
Sure.
PJ in the building.
That's right.
Last time.
It's really not the treasurer's job.
So
it's, it's the right thing to do.
Remind everybody that, in our June meeting, we're going to have the Narcan Train basketball team, we're going to honor them here, so that'll be nice. And also, we're going to have a presentation by our financial people regarding the ARPA funds. As we requested of them. So everybody's on the same page and know where we're at. Okay?
And it certainly didn't, it already passed.
With that, we're hopefully- I need a motion to adjourn.